Hello, everyone. Welcome to this webinar hosted by the Pasteur Network. We'll be spending about 30 to 40 minutes together. We'll have a brief presentation followed by some time for questions and answers. Feel free to introduce yourself in the chat, your name, your organization, your role, where you're coming from, where you're joining from. And as I'm presenting, feel free to put questions into the chat as well. We will be recording this presentation and sharing, we can share afterwards. And yeah, so maybe I'll start. So I am Jessica Moore. I'm working with the Pasteur Network. I am the project manager for a project named the Climate and Health Observatory Accelerator project. And I'll tell you a little bit more about that. First and foremost, the Pasteur Network, I think there are a lot of people from the Pasteur Network on the call today, but for those that are less familiar, the Pasteur Network is a network of 32 different members, institutes across 25 different countries, focused on 4 different pillars of activities. So pandemic preparedness with a focus on climate sensitive disease, and that's the pillar with which this project sits. We also have research and development and innovation with work on manufacturing of therapeutics, diagnostics, and vaccines. We have a 3rd pillar around knowledge communities, and then a 4th pillar on equity and good governance. And I encourage everyone to go to the Pasteur Network website, which has been recently updated, to take a look at those different pillars and learn more about our board of directors, our strategic advisory board. Hisham can put the link in the chat for everyone. So with that, I'll keep going. What I plan to do is give you a brief introduction to this project, this Climate and Health Observatory Accelerator project. And then I'm actually going to pass to Raphael, who is actually working on this project as well. He's a fellow based in the Fiocruz Institute in Brazil. And he'll be able to talk a bit more about the activities of Fiocruz more specifically, and from his perspective as a fellow working on the project, and Fiocruz being an institute that is what we're calling an exemplar on the project. And I'll tell you more about that as well. And as I mentioned, then time for Q&A. So I'll keep going. I think probably many of us on the call will be familiar with some of these statistics and some of this information, but I just wanted to start off with a little bit of project context. So why is it important to have a project talking about the intersections of climate and health, potentially working towards building observatories across the Pasteur Network and globally? You know, it's a very striking statistic. 1 in 4 deaths globally are linked to avoidable environmental risks, and that's 13 million deaths each year. And very importantly, it's the most vulnerable who are hit the hardest. So children, women, low-income groups. There are new threats from climate and environment that are demanding urgent responses. And health systems are at risk if we're only focusing on the downstream for health and on its own, and without taking into account some of these upstream factors around environmental causes. It's important that we integrate those two and start thinking more big picture and more upstream. And this is the last point, is starting to change more and more. But few countries have dedicated advisory bodies to guide on evidence-based environmental health policy. So this project really sits at the intersection of climate and health, with a heavy focus on application to policy and informing decisions for policymakers. The objective for the Pasteur Network is to systematically and sustainably transform public health implementation, research, and policy decisions for the realities of the climate crisis. It's a 3-year project. We started in April 2024, and so we've been almost a year now, and we'll go until April 2027. The funders of this project is the Rockefeller Foundation and the Institute of Philanthropy. There are 3 main project activities, and I'll talk a little bit more about each of them. So I used the word exemplars before. Hubs is another word we could use. But basically, these are 3 institutes within the Pasteur Network who have been selected to be exemplars or hubs. Fiocruz, based in Brazil, which I mentioned, and Raphael will talk a bit more about later on in the presentation. We also have Institute of Pasteur of Dakar, based in Senegal. And then we have the Institute in Ho Chi Minh City in Vietnam. And I'll talk more about those exemplars in a minute. We also have a network of global fellows, climate and health fellows, of which Raphael is one of. These fellows are mainly early career scientists who will be working in their different institutes. There are 17 of them globally, across, I think, 15 different countries. who will be working with their local institutes, Pasteur institutes, working with local policymakers, applying their own interests and expertise and building off of the work that those institutes have been doing over the last few years as well. And then lastly, around shared knowledge. And there's two components to that. It's around internal sharing across the Pasteur Network and across the fellowship cohort, and also global goods. And I'll talk a little bit more about that as well. So three main activities around exemplar activities, the fellowship cohort, and then knowledge sharing. So if we look more closely at the exemplar activities, I mentioned the three institutes. Here they're sort of in order in terms of the more narrow focus into a more broad focus. So we have the in Vietnam, the institute based in Ho Chi Minh City, working on developing climate and health data warehouse to improve the accuracy for dengue prediction more specifically, building off a lot of the work that they've been doing around e-dengue and different modeling. Senegal is actually working with ANASIM, which is the local branch of the WMO, in improving and monitoring their reporting and interactive dashboard that was previously built for the Prime Minister. And so that, broadening out from just dengue, this will be more broadly on infectious disease. And then Brazil, the exemplar is based in Fiocruz. And so Fiocruz actually has their own climate and health observatory that's existed for over 15 years. So they'll be focusing on building interoperable and adaptable tools and templates to facilitate the creation and daily operations of replicable climate and health observatories across the network. The fellowship cohort, I mentioned there's currently 17 of them from low to middle income countries that are funded through this project. We're also open to and interested in other fellows, potentially from high income countries, if there's organizations that wish to participate, or other institutes within the Pasteur Network that wish to participate and are able to self-fund their fellow or select a fellow. We're open to increasing that cohort with additional funding coming from other institutes that might be interested. So if you have any questions about that, feel free to contact myself or Hisham, and we can discuss further. But currently the 17 fellows that we have come across 5 different continents. They're going to be fully dedicated for about 2 years. So they just started in January and they'll continue until the end of the project. And their goal is to strengthen public health action on climate risk. They will be supported by the exemplars, or those hubs that I mentioned, external partners, and also via the Pasteur Network Strategic Advisory Board. Mainly what the fellowship cohort is doing, they're building ties with the national climate and health stakeholders. They're mapping climate and health research and identifying scalable tools, facilitating peer learning and cross-network collaboration, and acting as ambassadors within and beyond the Pasteur Network. To talk a little bit more about shared knowledge, so I mentioned those 2 different components. Knowledge sharing will be particularly important for this project, but it's obviously tremendously important for the Pasteur Network and beyond. What we're trying to do within this project is to foster knowledge sharing through the network and develop globally relevant insights around stakeholder needs, public health and research challenges, use cases for climate-informed public health insights, proven solutions and products, and operational best practices. Global goods is maybe a term that not everyone is familiar with. This is actually a term that the Rockefeller Foundation has been working on for quite some time in partnership with a platform called Digital Square, which is hosted by an organization called PATH. And then the global goods essentially is, these can be digital global goods, or these could also be, could be as simple as a case study, a protocol guideline. But at a larger sense, it could be software, it could be a data platform that is globally and freely available and that is shared. So within the context of this project, the exemplars will be focusing on developing global goods that can be shared. For example, an improved dengue prediction model in the case of Vietnam that can be shared, or at least components of it and sort of the background of how it was developed can be shared for others to build off of. There's also, importantly, an internal knowledge sharing platform, which Hisham is in charge of and managing, for the fellows, first and foremost, to be able to coordinate across each other. A lot of them will be focusing on infectious disease, and so we want to make sure that they're coordinating and discussing as much as possible and building links and networks for themselves. For the Pasteur Network more broadly as well, for us to be able to share information and then to be able to disseminate that more broadly. So to summarize, key activities for the project is really very important to build those connections across exemplars, across the fellowship cohort, making those connections early on with local stakeholders to assess the local needs. And that is really a lot of the work that the fellows are doing right now. Conducting research when and where needed, documenting and disseminating via Global Goods and the Digital Square platform. Training, both receiving training for the fellows and then probably next year for the fellows and for the exemplars to be developing and to share out training on the lessons learned on the project later on, and building partnerships for the sustainability of the project. This is my last slide before I turn over to Raphael, just to give you a sense of the timeline and how that builds out over different phases. So we are still early on in 2025. So in this early phase of laying the foundation. So the exemplars, for example, conducting landscaping, they're looking into what capacity building might be necessary, convening stakeholders to co-create and to align on the goals of the project. And the fellows are at this stage identifying the priority areas of focus and which partners they'll be working with, conducting mapping of what tools and resources are available, and supporting any development of global goods with the exemplars, or drafting or thinking about what global goods they will be able to develop. And then as we move into 2026, there'll be the piloting and validation phase where exemplars are developing, piloting solutions. They might be collecting additional data, coordinating with other exemplars, iterating based on stakeholder feedback. And the fellows will be coordinating across themselves and continuing to develop their global goods. And then in 2027, we'll be scaling and sustaining. So this, in terms of the ambitious objectives of policy change, a 3-year project actually does feel quite tight and short. So phase 3 will be really focused on what will happen after, how this might continue, how we can make sure that it's integrated locally and also connected to different global initiatives, and decide how we can codify those global goods and document and share lessons learned. So again, feel free to put questions in the chat. We will have some time at the end to go through. But for now, I think I'm going to pass to Raphael, who is the fellow from Fiocruz in Brazil, and he has a few slides which I will be able to walk through. So Raphael, I'll keep sharing the slides myself. Just let me know when you want me to advance on the slides.
All right. Thank you, Jessica. Thank you, Jessica. That was great. Thank you very much. So my name is Rafael Saldanha. I live in Rio, in Brazil. It's a beautiful city, very interesting to be at. So I am a geographer who fell in love with a field called health geography. I did a master's on public health and then a PhD on health communication and information. And more recently, I finished a postdoc at INRIA in France, in Montpellier, working with machine learning applied to public health issues and climate and health at the climate and health field. And I'm very happy to be now part of the climate and health accelerator program from the Pasteur Network. So I'm now a research fellow of this project, which I am very proud and happy to be part of it. And I wish to share with you some thoughts, some insights about the work that we have been doing here in Brazil at the Brazilian Climate and Health Observatory that is part of the Fiocruz. So then I will talk more about what we do, what is Fiocruz and the work that we have been doing. And first, I would like to present at least our view of what is a Climate and Health Observatory. Different projects can have different views of that, and we follow the lines that are present on this slide. So first, our view of a Climate and Health Observatory is something that combines academic and state public health, data, information, etc., to provide a high-quality, relevant intelligence for those who need it. Who needs this kind of information? You can talk about stakeholders, the government, and also the general public as well. On our view, a Climate and Health Observatory works on a shorter time scale. That's something that can be hard for academics to present data and information, analyze things for the next week, for the next month, or for the previous month. So we work usually in a shorter time scale to present data that is relevant for action that takes place right now. The work that we do is heavily based on synthesizing existing data, so secondary data that's already available, and also collecting data on target areas that's very special for us. So have data on nationwide coverage that is collected by the government and other sources. Then we synthesize this kind of data and also collect data in the field for target areas. That's something that usually a climate and health observatory does. And it's important at this point, we generally, a climate and health observatory works with a variety of diseases because the climate and health interface is very broad. So it manifests in a broad view, a broad range of disease. So we try to work to cover at least a part of this range of disease and health outcomes from climate. And this kind of data needs to be collected and harmonized to be on the same user, the same spatial and time units. So this heavy work that we do in a climate and health observatory. And something about the analysis and statistical models that we usually do, something very important about that is to respect the direct and indirect relationships between climate and health process. Because, well, sometimes the climates can impact directly the health, like in a drought, in a flooding. So we have a short time response on that, short time effect on that. But sometimes the climate can have a more indirect, more subtle influence, like the climate changing the agriculture to crops, then you have effects on nutrition, for example. So it's something very important to respect and to acknowledge this kind of effects. And something that I did not wrote in the slides, but also important, is the lagged effects of climate on health. For example, the incidence of dengue or some kind of infectious disease of today is not from the weather from today. It's from the weather that happened months ago. So it's a lagged influence as well. And finishing this slide, this kind of analysis models, the results from this must be useful for public health planning and for implementation. So that's basically our view of what is a climate health observatory. So where are we, the Climate and Health Observatory from Fiocruz in Brazil? We are linked to the Brazilian Health Ministry, who lists the SUS. We have in Brazil a universal coverage health system. It's a huge challenge for us to maintain, and it's very special that we're very proud of that, to have a universal coverage health system. And inside the health ministry, we have the Fiocruz. Fiocruz basically is a public health institution that works on several areas. We came from drugs and vaccines, research and production, we have factories, but on the other hand, we cover also health policies, guidance, implementation, working on theory and practice, on public health. So the Fiocruz works in a broad range of areas, from basic research to guidance in politics and policies as well. Inside Fiocruz, we are inside an institute called ICICT, that focuses on health information and communication. And inside the ICICT, we are on LIS, that is a lab that focuses on health information research, like indicators, health indicators, and modeling. That's our organogram, basically. Excellent. So more specifically about our climate and health observatory, Our goals are about to collect data and harmonize them in the same spatial and time units. Then we serve and we want to serve as a center of integrated data about climate and health, presenting data for public and stakeholders, government, of climate and health data that are in the same spatial and time units that can be easily used and modeled and analyzed. Another goal that's very important for us is to develop indicators that face the climate impacts of disease transmission and also the social inequalities of health that the interface from climate and health produce. Not the goal is to analyze this kind of data with scientific methods, of course, and to produce not only academic deliveries like papers, books, and etc., but disseminate our results of our research to stakeholders and the public in a form that they can understand and use it to guide policies and practice, as an example. And another goal is to facilitate technology transfer between on this field. Right? Next. Can you go to the next slide, please, Jessica?
What What do we do?
That's right. Thank you. So what we've been doing lately on the climate and health observatory in Brazil is to maintain an updated database of climate and health data indicators. We create climate and health situation analysis. This comes from a field that is called health situation analysis, where we try to identify trends and patterns on climate and health. We disseminate our results on open access interactive dashboards. So open access for us is very important, not only the dashboards, but our data, our methods, our publications are primarily open access. That's something very important for us. We produce, of course, academic papers, book chapters, notes, interviews to the press. That's something that we trying to do more to communicate with the public with technical notes and interviews to the press to disseminate the results that we produce. We work also contributing to early warning systems for emergencies related to climate change. We have a few in the last months in Brazil, and the observatory has been working with them in partnership with the government and other institutions in Brazil. We also support research from students, from other people that developing innovation in Brazil and other countries. So this is support research at Fiocruz for the people and for the institutions as well. And finally, we are also the participation of civil society to monitor policies and health and climate conditions through our data, through our database, indicators, and the kind of results that we produce. Next. So Jessica mentioned that the Observatory of Climate and Health in Brazil has had his anniversary of 15 years this year. So it started somewhere in 2010, producing 15 years of relevant, high-quality research for the society. In this picture here, we have Cristóvão, Diego, and Renata. They are all the current coordinators of the observatory. Cristóvão is with us in the room, so if the time allows, he can talk a little bit more about that. And this 15 years of experience is very, very important, very interesting, because, well, nowadays, climate health is very important. Almost everyone recognizes that. We have funding, we have evidence on that. It's something that is on the hype maybe, but it's important and acknowledged right now. But thinking about that 15 years ago, 10 years ago, the challenges that those folks faced to build this observatory and show to the Brazilian offices and to the world as well the importance of climate and health research There's those very important lessons about the importance of this field. So the end of this slide is a web link to our website, and you can go later after the presentation. And now I have some pictures of the work that we've been developing at the Observatory. This is a dashboard where we present our indicators on health and climate for all Brazilian municipalities, the 5,000 and more municipalities that we have, that keep updated with indicators. Next. This is another dashboard that we've been working with the impact of disasters, climate-related disasters on health, especially on the healthcare network. So when disasters like a flooding or a drought happens, how the healthcare network responds in terms of to absorb the needs of the population, to send patients to other places. It's a project that we've been working more recently. Next. And another project is our health monitor on droughts that we have in the semi-arid region of Brazil, that we monitor a range of climate indicators that are more dedicated to monitor drought, like the severity index of Palmer. We relate these with some indicators from climate sensitive diseases, that especially for droughts as well. Those are three from our projects. We have a lot of other projects, dashboards, and research that have been producing. It's just a sneak peek of doing here at the observatory. And I'll be happy to take questions, to talk with you more. And that's it. Thank you very much.
Thank you so much. I'm going to stop sharing my screen, but we can certainly go back to any slide that we need. And I think we have about 10 minutes for questions. So first of all, thank you so much, Raphael, for that great presentation. I'm going to scan through the chat right now to see if there's questions there. But if anyone has a question that you want to raise your hand, and then we can go around and yeah, questions for myself, questions for Raphael, questions for, there's some other fellows of the project that are also were able to join us if you have questions on that. And if Christovan also is here, Christovan, if you want to say a few words, feel free, you can just come off mute directly and say a few. But yeah, as people are thinking of their questions.
Yeah, it's an important occasion we have to know each other and exchange some ideas and beginning to organize and disseminate some technologies and according to local priorities. The question I have is that in Brazil we have the free open data for health, or some for some register like hospitalization and disease notification, deaths and newborns, many data. We have to treat it because it's not perfect. It has many pitfalls. But the question is, are the other countries like that? Do we have the free and open access to health data so we can build these indicators? Sometimes some countries don't have this data infrastructure. Sometimes it's very delayed. After 5 years, the health register are made available, and we are trying to work with other countries, and each country has a particularity in health data availability. So it's a question for Raphael and everybody. Thank you.
Thank you, Christovan. This is such an important question and topic for this project. I don't know if a few people want to raise their hand and answer, Christophe, and we might not have a chance for everybody to answer, but if people also just want to put in the chat their thoughts on that, it might be interesting if we can get a lot of answers from different countries, and then we can sort of compare across, because I'm sure the context is different. So yeah, anybody want to answer the question for their own context, and just let us know what country you're speaking from?
Noel has a question. Yes, please, Noel. Sorry.
Yes, indeed, I will not answer particularly. I will add something more. Is that usually in most of the country, the health data are more or less private, as it has been said before. Sometimes it's shared, and this is very interesting what has been shown in Brazil, where you have sort of open access, but it's not open access all the time. This is for the health system. For the meteo data, for example, this is more or less done by satellite. So yes, it could be country dependent, but it can also be, let's say, globally done, because not all the country have the capacity of having their own satellite. So how would it be possible in this type of topic, in this kind of that type of a project, to try to connect what is available in the country at the health system, and how to connect that to sort of global, let's say, global data that would have been obtained by satellite at a larger size.
I can try to start answering, and then I think others, maybe some of the fellows, want to share a bit as well. But because I think it is very country and context specific, and so part of what the fellows are doing right now in the first few months is identifying what data is available, which indicators are within that data, who owns the data, what's shareable, what's not shareable, what are the conditions around that data. At that level, the project itself and Rockefeller Foundation has been collaborating and working a lot with both the WHO, but the WMO, World Meteorological Organization. And for example, Dakar, which is the Exemplar, was signed an MOU to work with ANASIM, which is the local branch of the WMO. So I think those sorts of collaborations help make those connections. There's also, for example, global initiatives to add a climate module to DHIS2. And so GNUME, who's on the call from Guinea, for example, will be supporting an initiative to help work on that. There's also, I think, Saren, who's a fellow from Cambodia, worked on that previously. That won't be the focus of her time on this project, but we're connecting the dots between those as well, because there are global initiatives in place to help make that make those connections, global databases. And I will say, I think part of the interest in the funders. Can you please go on mute? I don't know who that is, Angela, maybe? Part of the interest in the funders of picking the Pasteur Network is because of the amazing and deep and longstanding relationships with Ministry of Health that they have, and that is the more difficult data to access. And so the Pasteur Network really can play an important and interesting role at this conversation of climate and health, because as you mentioned, the climate data, there is global data, it's not as sensitive, it's more easily accessible. And so if Pasteur Network can integrate that into all of the work that they've been doing, and with the sensitivities that precautions that they are now naturally, they naturally take, they're really an interesting partner for this intersection of climate and health. So those are a few thoughts. I'm not sure I answered fully your question, Noel. But yeah, I don't know if anyone else has other comments they want to add to that, or if Noel, you want to, anything that you want to add. If not, there's another question. Yep.
And maybe I can add something on that. Just like sometimes on climate and health research, we use, sometimes we tend to use more aggregated data. So we aggregate case of these regional geographical boundaries, like how many cases we have of disease or the incidence rate of disease in a region, a neighborhood, in a municipality. And this kind of data is more easily obtained because you cannot see the names of the people or the individual aspects of the person, so there is less problems of sensitive data. So maybe it's a way to start the relationship with the stakeholders, to ask aggregated data that serves a purpose, like for instance, rates computation. But of course, to have access to the raw data of these low cases, we have more liberty to create another kind of indicators. It's important as well. But maybe a start is to have the aggregated data compute indicators. Maybe start a point to start.
Yeah. Thanks, Raphael. Another thing I'm thinking of as well that I think is important is the coordination with Digital Square. So they've historically have a lot of global goods specifically for health, and now they're developing their guidance and guidelines around global goods at the intersection of climate and health. And we are participating, for example, Christovam is part of the steering committee. We have other representation from the network to be part of those conversations around what global data is available and how we want to harmonize and have a more systematic approach to those databases, what's possible, what's not possible. So we're connecting to that sort of global initiative as well to help make sure that we're connecting with what's available and helping to inform, you know, some of the ways that data is being shared and used. So I know we're actually at time. We decided to do 40 minutes because we felt that that was a nice amount of time for a little chat, but I don't know. I know there's a question in the chat.
I have a question if you don't mind, because it's for me it's very interesting how the way you are working and to collect data. I'm just wondering how you work with civil society organizations, mostly citizens in general, to collect data, because you need a huge amount of data for climate and health activities. And how do this work is defined, and how is it in co-creation, and at the end, because you said it's an open access approach, and who is responsible of using this data?
That's a great question. I don't know if Christovam has thoughts. Yes, go ahead, Hisham.
No, it was one of the points raised by Raphael. That's why I asked.
Okay. Yeah. Well, sorry. Then Raphael, did you want to take that one?
Yeah, I can start the answers, and of course, Gustavo can add some points as well. Well, the data we collect is already open from the Brazilian Health Ministry. So the data comes already in an open format and disseminated in an open philosophy from the Health Ministry. So it's very easy for us in the Brazilian case to access data, raw data, but without the sensitive information, of course, of names and identification, address. But we have access to the raw data, individual cases of disease from the Brazilian Health Ministry in an open format, in an open access philosophy. And Hisham said about the open access. Yes, we produce open access research, and who is using our research are post-academics from access our papers and data. But we have a very important partnership with some places that we call Sentinel sites, that we develop partnerships with them as a local strategies. So we go to the field and create some kind of partnership with them to help them to collect data, and then the Observatory aids the partnership on collecting data, storage of this kind of data, computation of indicators. And this data is available for us, to the community, and also to the Sentinel site people, to that partnership. Okay. That's a very specific way that we've been developing that is working very, very well, I think. Maybe Christoph can add more on this, but it's something very important for us.
Thank you.
Do we have any some time, just a few minutes. I think we have been working with two scales, the national scale and some local scale. In the local scale, we try to co-produce the monitoring systems and etc. So we do some preliminary workshop trying to understand the priorities, needs in each site. Sometimes dengue is very common concern in Brazil. Sometimes they mention droughts and floods, and it's very important to understand it, to make a kind of contextual analysis of what's happening and what can be changed due to climate issues. In the national, so we after we build a draft of our systems, we go to the field and show and see if it responds to the local necessities with civil society and also health stakeholders and etc. In the national scale, it's difficult to do that. So sometimes we use the press for communicating, hearing the needs, trying to understand what's happening in the country and in all regions in the country, and also communicate to the civil society through the media. Digital media and local press, and this has been very interesting. Even during the hard times we had in the former government, kind of well, it was not permitted to talk about climate change last years. So the press has a very important role in disseminating, for instance, the effect of El Nino, how to take care of our system during El Nino peak, and in the last years there will be some floods in the south of Brazil, droughts in the north, the health consequences, and I think we can also reach the health professionals from media easier than the institutional way, easier than that. I think it's very important. We hope to do a kind of to produce a kind of collecting data from media. It's also important, but sometimes the media can't. They register or notify an outbreak better than the health system. There is an outbreak of dengue there and then, so we can organize those many clouds of data to understand the national needs and national priority.
Thanks a lot, Christopher and Rafael. Maybe we'll talk more in Hong Kong.
The upcoming project meeting in Hong Kong.
Yeah, so.
Great. I think we'll close here. We're going to share the recording for those of you who registered. And if you have any other questions, I shared my email address. Rafael shared his email address in the chat. And we'll get back and share information. Really big thank you to Rafael for presenting. Thank you so much, Christopher, for joining and sharing as well. Thanks everybody for joining, all the fellows as well. Yeah, hopefully this is helpful. It's just meant to be a quick, introduction to the project, but they'll be sharing more information as the project continues. So thank you so much.
Thank you. Bye-bye.
Bye-bye.
Bye. Thanks.
Thank you, everyone. Bye-bye.